because of a new system that provided more equity to our lower wage workers. I'm here today to say that the proposed rate increases that you're looking at represent the biggest shock to the SEB system since our launch. And that comes with a great deal of concern and not looking forward to these next few weeks of sharing information and the response that we will be getting. It could be very disruptive to our membership. I just want to echo comments made by the board this morning about the expected impacts on bus drivers, on paraeducators, kitchen workers, and many other classified school employees. I want to thank you for your understanding, for your sensitivity to the lower wage earners in our schools and how difficult these decisions are going to be. I want to take issue with a comment that was shared by one of the representatives from Kaiser Permanente earlier this morning, that they hope that this is a once in a generation event. I'm here to say that these substantial rate increases, if they are adopted, will never go away. They determine a new baseline for all future rate increases. So this is not a once and done thing. This is going to remain in place forever. Further, as school employees make informed choices and they likely move away from various Kaiser Permanente plans, the board will likely face the prospect of offering fewer SEB choices in the future due to enrollment declines. These plans will just not become sufficient to continue in the future. So I want to thank you for all of your hard work, your diligence, you're staying at it, like not taking the initial proposals, but keep digging at it. I just want to say, stay focused on the impacts of the thousands of devoted women and men who provide students with important services and supports in our public schools. Thank you very much.
If you're making the trip today, thank you. Jared Mason, here. Are you out there?
Yes, good morning, Chair McDermott, members of the committee. Thank you for taking my testimony. Jared Mason Gear, representing the Washington Education Association and approximately 90,000 educators across the state. We also share, as you might guess, enormous concern with the proposed rate increases that are being discussed today. I want to call to your attention a letter that was submitted by a range of frontline workers within the SEB system, labor stakeholders that have the same concerns that WEA does. Obviously, enormous concern about the impacts on the workers we represent and their families at a time when many workers are having really great difficulty meeting their financial needs in the face of dramatic inflation, particularly for classified employees really having a difficult time keeping pace with that, and they're not seeing that reflected in their paychecks. But beyond just the individual impacts on workers and their families, we are very concerned about a long-term impact potentially on the K-12 system, where we obviously know that many of the employees are drawn to this work because of the ability to serve students and make an impact on our society. But there are a lot that we also know are motivated to come into this work because of the strong health insurance benefits and the quality and affordable care that they have access to for their families. Increasingly, we hear and see from the members we represent that they are no longer feeling that is continuing to be the case, that these benefits are so desirable when we are seeing that a lot of other comparable work is paying better. And in many cases, there are jobs available, particularly to classified employees that do not